The following presentation was recorded at the 2017 ANZICS Safety and Quality Conference.
Thank you, Rick and Daryl and the rest of the organising committee for inviting me today. I'm standing on my tiptoes, if you can tell. I've been a doctor now for 15 years, and I can't imagine my medical life without med calls. So my talk today is really based on my experience of running to multiple meds, including the time during my actual physician's exams, my FRACP exam, the short case turned into a med scenario, and I had to help resuscitate the patient. So medical emergency team, who are the staff that make this team? Well, it really depends on what health service you come from, but generally it's a combination of nurses, doctors, allied health, and ward support. They are united by some common goals with the aim of ending up delivering good patient care, but also good staff care, so that by the end of the med call, the staff feel like they've learned something, they feel empowered, and they feel like they're able to speak up the next time around. In order to achieve these aims, the med staff have to be armed with technical skills, the non-technical skills that were mentioned earlier on. There's a lot of education around teaching these technical skills and non-technical skills in hospitals, but what's often not talked about is confidence levels of med staff as well as their psychological state, and that's what we will address today. So confidence, this is faith or belief that one will act in a right, proper, or effective way. And there's usually a spectrum of confidence, going from the very underconfident individuals to the arrogant and beyond. People tend to bounce across this spectrum, and there's a very fine line that divides the different degrees of confidence. And this line can be difficult to define, given that it depends not only on the individual, but also on the perceptions of other people. So what affects the confidence levels of staff members in a med team? Is it their position in the hospital hierarchy? Is it their technical skills? Do members of certain departments come across more overconfident and arrogant? Any neurosurgeons in the staff? Here's a question to the audience later on for discussion. Are boys more overconfident and arrogant than girls? Does your hunger level affect your confidence levels, or if you're bursting and need to pee? Your personality type, does that affect confidence level, or your zodiac sign? Don't know. Good discussion points. But we know that being confident is helpful, not only for looking after our patients, but also for our team members. What we know, however, is that being on extreme ends of that spectrum, very underconfident or overconfident, is not good for anyone, really. We've all been to med calls where there's no clear leadership, a decision needs to be made, and it's just not being made. We've also been to med calls where a couple of members are arrogant, don't want to listen to the team members, know what they're talking about, and refuse to take advice. And that puts the patient in a dangerous situation because mistakes are made that way. So let's talk about individuals who lack confidence and how we can build this confidence. Well, there is no argument that they need to develop non-technical skills and technical skills in order to have some confidence while managing patients at a med. These skills have been defined well in literature and has been a focus in lots of education sessions. In addition to training for non-technical and technical skills, these individuals in a med team can also train their mind to manage stressful situations. Now, members of the Navy, the Army, the police force, astronauts, sportspersons, they've been turning to psychological skills to enhance their performance for years. However, we expect members of staff to go and manage stressful situations without getting any psychological training. Now, it's beyond the scope of this talk to go into this topic in a lot more detail, but certainly the kind of skills that I like teaching my juniors include mindfulness breathing, visualization, but also power posture, power posing, which essentially means standing in a posture that shows confidence and it helps you act that way as well. There are some responsibilities of the organization as well in terms of improving confidence in Met staff members. And these include clarifying what individual expectations are and also providing with an escalation plan in order to, if they're feeling out of depth. I remember many years ago when I was a little medical registrar with no airway skills, going to a Met call on this little old lady who was choking on a piece of dumpling brought in by her family. I was terrified as the medical registrar. All I could do was give her back blows, but then I escalated very quickly, and the ICU consultant came up and promptly saved the day with a pair of McGills, so I was very grateful. I've also learned a lot as a little registrar from my own seniors and seeing them run Met calls, but also when people gave me feedback on how I was performing during Met calls. Controlling confidence, the other end of the spectrum can be tricky because individuals who come with a lot of confidence also very often lack insight. And these individuals also need training with technical and non-technical skills because, and this is necessary to challenge the cognitive bias that they have where they are not aware of their incompetence and are actually very confident that they are competent when they actually aren't. And they also gain from feedback and role modeling and mentoring. But what's really important is not just to change the individual, not just to change the arrogant and the overconfident individual. What's important is to challenge the culture in medicine where staff members are considered invincible and infallible and where asking for help is frowned down upon. So just to summarize, targeting confidence management can be tricky business. We don't really know what the right level of confidence that will work in every situation. There's possibly a range that's okay. Keeping behavior within that range can be tricky, but we know that either sides of the spectrum are not good for the patient or for the staff. Thank you very much.